This is Plant-Based Briefing, Healthcare versus Disease Response System, Part 2 by Nelson Huber-Disla and Colin Campbell at nutritionstudies.org. And I'm Marian Erickson. This is the Plant-Based Podcast where I curate a variety of content on plant-based and vegan living written by experts, get permission, and read it to you here in about 10 minutes or less every weekday. This article from the Colin Campbell Center for Nutrition Studies is a two-part article. I read part one yesterday, and then this is the second part. So go back and listen to yesterday's first, and then come here for part two. And now let's get to today's plant-based briefing. Healthcare versus Disease Response System, Part 2 by Nelson Huber-Disla and Colin Campbell at nutritionstudies.org. In Part 1, we saw that the disease response system is characterized by a heavy reliance on technology, especially pharmaceutical advances, and reactivity as opposed to proactivity. Although that article included a few startling figures on the deaths and accidents caused by prescription drugs, a more general question remains. How effective is the disease response system as a whole, and how do we measure its effectiveness? Life expectancy, an incomplete measure. Many public and professional commentators use life expectancy to assess the healthcare system's effectiveness. This is a limited indicator of overall health. It's important to live a life that is not only long, but also healthy, so we should not take life expectancy as the be-all and end-all. Nevertheless, life expectancy trends can be useful. Here's what those trends show us in the U.S. From 1960 to 2014, life expectancy increased from 71 to more than 78 years at about 2 months per year. In 2015, life expectancy increased by only 1.2 months. From 2016 to 2018, life expectancy decreased from 78.8 to 78.6 years. This is the longest decline since the Spanish flu and World War I, 1915 to 1918. This decline has been widely discussed for good reason. It is a cause for serious concern. The prevailing wisdom attributes much of the decline to increasing overdose and suicide rates, but the story is more complicated than that. Many factors contribute to overdose and suicide rates, and it can be difficult to parse them. As mentioned in a previous article linked here on the costs of malnutrition, so-called deaths of despair do not exist in a vacuum. To get a fuller picture, we must look beneath our despair and understand how we suffer individually, communally, and societally. Part of that process is admitting the role of factors like malnutrition, chronic disease, and the general failings of our costly disease response system. Still, the overall life expectancy trends outlined above don't seem that bad. After all, life expectancy did increase steadily until 2015. This is a welcome trend, right? We must be healthier overall if we're living longer, or so the thinking goes. It turns out that much of the increases in life expectancy are due to improved strategies for responding to disease, especially emergencies. Improved rapid response to heart disease in particular has resulted in fewer years lost prematurely. Advances in how the medical system responds, especially to acute illness and emergency, obviously deserve recognition. But let's be clear, they do not prove that our overall health has improved. These trends suggest that the disease response system has improved its methods of responding to disease. Disease incidence. Perhaps a better indicator of health, or a lack of health, is trends in the incidence or number of new cases of our greatest killers. These tell us whether we're doing well to prevent disease in the first place. Looking at those incidences, we see somewhat of a mixed bag. The incidence of heart disease and stroke have remained relatively stable in recent decades. The incidence of diabetes, the most expensive chronic disease in America, costing $327 billion per year, has increased dramatically. Age-adjusted incidence rates of diabetes doubled between 1980 and 2008 for both men and women between the ages of 18 and 79, and the age-adjusted death rate for diabetes also increased by nearly 50%. Except for a couple cancers, including cancers of the lung or bronchus and of the larynx, the incidences of which have decreased due to reduced cigarette smoking, there has been little favorable change in cancer incidence rates in recent decades. The incidence of certain cancers has even increased. This final example, cancer, illustrates the point about living with disease, i.e., responding to disease after it's developed, without preventing or treating disease. The result of this combination is that there is a more substantial proportion of cancer patients living in our society today. While this is obviously preferable to the alternative of cancer patients dying at a higher rate, it gives you an idea of how healthcare spending has increased to such an unsustainable extent. Takeaways. Undoubtedly, improving disease response is a worthy goal. In emergency cases, improved disease response is often the difference between life and death. We should never deprioritize that response. But when it comes to diseases that can also be prevented and treated, the relative ineffectiveness of our prevention and treatment does begin to stand out. The comparison of lung cancer illustrates this point quite well. We've been successful in decreasing the incidence of lung cancer, but why? Is lung cancer really that much easier to prevent than diabetes, which has moved in the opposite direction? Are we dealing with these two diseases differently? If so, why? If they're both preventable, why is the messaging from authoritative health policy institutions so different? If taking a stand against smoking has proven effective, then why have we not yet taken a stand against the standard American diet? Incidentally, 50 years ago, it was shown that a healthful diet can also reduce lung cancer deaths, especially among heavy smokers. The National Center for Chronic Disease Prevention and Health Promotion has a page dedicated to the health and economic costs of chronic diseases. While it mentions cigarette smoking and alcohol consumption, it does not mention diet. I wonder at all the reasons why, at all the industries that profit from the food you eat and the management of the resultant diseases, at the limited strategies by which we respond to these diseases, and I wonder what the incidence trends of diabetes and other diseases related to malnutrition might look like if our society treated the consumption of provably dangerous foods the same as it treats the inhalation of provably dangerous tar and nicotine. You just listened to Healthcare versus Disease Response System, Part 2 by Nelson Huber-Disla and T. Colin Campbell at nutritionstudies.org, and I'm your host, Marian Erickson. This article is part of a series written about the book, The Future of Nutrition, An Insider's Look at the Science, Why We Keep Getting It Wrong, and How to Start Getting It Right, written by Dr. T. Colin Campbell with Nelson Disla, which was released in December 2020. I've also done a number of other episodes on topics related to this. I will link some of them in the show notes, including 468 and 469, The Industry Playbook, How Food Companies Distort Nutrition Science, 118, How Smoking in the 50s is Like Eating Today, and 92, No Purveyor of Unhealthy Products Wants the Public to Know the Truth. And of course, please check out the previous 2 episodes which were part of this series. And please share this episode with anyone who might benefit, and thanks for listening.